So today we're going to auscultate heart and lungs. To do this on a dog, you would use your stethoscope and you would place the diaphragm right behind the elbow on the chest while the dog is standing. You would do this on both sides of the dog, both sides of the chest. For cats, you would start out in the center of the sternum and then move outwards to the left and right. Normal heart rate for dogs is between 60 and 160, and for cats 140 to 220. To figure out the heart rhythm, it should be normal. Each heartbeat should be separated by a time interval equal to the next. Heart rhythm, dogs can have a respiratory sinus arrhythmia, which is just when the heart rate speeds up a little bit on inspiration and slows down a little bit on expiration. That is normal for dogs. To best evaluate the rhythm, you would want to listen with your stethoscope, listen to the heart, and palpate the pulses at the same time, and you would want to feel equal intensity at the same time between the heart rate and the pulse. If there is a abnormal heart rhythm, then you would want to do an EKG. Okay, for heart sounds, what you're listening for is the lub-dub, which is the S1 and S2 heart sounds. If you hear an extra one, then that would be considered a gallop, and you would want to do an ECG. You would also be listening to murmurs, which is a swishing sound, and that's the turbulent blood flow within the heart. And if you hear that as well, you would want to do an ECG. Okay, for lung auscultation, what you would do is you would listen with your stethoscope, and you would actually divide the thorax into 9 different quadrants. So 1, 2, 3, 4, 5, 6, 7, 8, 9. And into each quadrant you would listen for 2 to 3 breath cycles. And if the dog is panting, you would want to just gently close their mouth so you could get a better listen. Air movement should be audible upon inspiration and expiration. If you hear abnormal sounds like crackles, that could indicate fluid in the alveoli. Wheezes can occur if there's a narrowed airway. And then if you hear diminished lung sounds, it may mean pleural effusion, pneumonia, a pneumothorax, or even possibly a mass. And if abnormal lung sounds are heard, you should indicate whether it's inspiratory or expiratory. And then you would possibly need to do an x-ray. Okay, all right, so we're gonna do a free catch urine here. So the first thing I'm going to do is clean the prepuce, just to make sure to get any bacteria, sorry bud, off the end of the penis here. And you just do it gently, you don't need to scrub really hard. Okay, and I've got my ladle, and now we're gonna get the free catch. So we want to get it midstream to try to help eliminate whatever bacteria is on the prepuce. Okay, so we want to get it midstream. Okay.
Good boy, George.
All right, and that is how you get a free catch urine sample. Okay, so today I'm going to show you how to clean a cage. We use this Husky 890 Veterinary Disinfectant Cleaner. It's a virucide and a mildew stat. So how you clean the cage is we spray it and let it sit for 10 minutes. And then we will wipe it down. All right. Okay, so it's been 10 minutes. Now I'm going to wipe down the cage. And you can also spray it down again If it's dried a little and looks a little streaky. Okay, and last step would be to wipe down all the bars on the front of the cage, on this side and the outside. And that is how you clean a cage. Okay, so today what we're going to do is we're going to get a sterile urine sample with male intermittent catheterization. So what we're going to do is we have them in lateral recumbency. I am going to extrude the penis. We're going to clean it with iodine. So she's got her sterile gloves on with a sterile syringe, and then she's going to take the sterile red rubber and with sterile lube that she has here on her packaging, and then she's going to insert it until we get some urine back, and then she's going to use the catheter to draw out the sample. Let's do this. Sorry, buddy. It's cold. It's cold. Sorry, bud. Okay. Alright, so what we're going to do is do a cystocentesis on this Rottweiler. So I am helping to restrain while Dr. Patino is using the ultrasound to find the bladder. He's got a 6 ml syringe with a 1.5 inch needle. And so we put a little alcohol on the bladder, and he is using the ultrasound to locate the bladder. Now he's getting the sample. Okay, so we got our sample, and now we will put it into white top tubes that have no additives, and that's how you perform a cystocentesis. Okay, so today I'm going to demonstrate how to express a dog's anal glands. So every dog has 2 anal glands, or also called anal sacs, and they empty each time a dog goes to the bathroom. Sometimes dogs do have issues emptying them, or they could become clogged or compacted. And you might notice licking back here a lot, or even a lot of scooting the butt on the ground. So what we're going to do is I have my helper here holding the dog. I'm going to put on gloves. I've got Vaseline for a little lubrication, and I've got some damp paper towels to wipe away the expressed fluid. So what you're going to do is you put your gloves on, you get a little bit of Vaseline or some sort of lubricating jelly on your finger, and you are going to use your index finger to insert into the dog's rectum, and you're only going to insert about a 1/2 inch or so, pretty much just to the length of your first digit. So I'm going to insert my finger into the rectum, and then I'm going to feel on the right and left side of the anus. The anal glands usually live at about 4 o'clock and 8 o'clock if you're using a clock reference. And I'm going to gently squeeze and milk outwards. And it's important to have a helper because most dogs do not tolerate this procedure very well. Okay, so I've got my finger in the rectum. I'm going to place my damp towel kind of over my hand in case there's some squirting action here. It usually feels kind of the size of little grapes if there is fluid in there. So I'm just going to gently milk outwards. His are not very full. Okay, so that was the left side. Feeling on the right side, just a little bit about pea-sized. Just kind of milk outwards. Okay. And then you're going to wipe the rear end real well, because sometimes it can really stink. And sometimes you might even want to give a little bath afterwards. I didn't really get anything out. His glands are not full. It should come out as kind of a brown liquid. If it comes out thicker than that, then it means that there might be an issue going on, and the veterinarian should address it. But that is how you express a dog's anal glands. Okay, so today what we're going to do is we're going to perform an enema on this dog. So the first thing we did was we mixed some warm water, not hot, but some warm water, and we mixed it with some sterile lubricating jelly. And this the doctor wanted kind of a 1-in-1 ratio, so about half jelly, half water. So we mixed that in here. We drew it up. We're going to give a 60 milliliter enema. So I have my sterile red rubber catheter, and this isn't a sterile procedure, but this is sterile. It is new to him, and we will be saving this and reusing it, but the first time we do it, it is sterile. So sometimes the doctors want to use soap in with their water, a lot of times with the jelly as well. Sometimes they could use lactulose, but this particular doctor just wanted about 1-to-1 ratio of lubricating jelly and warm water. So what we're going to do here is I'm going to open my catheter, and I'm going to put some sterile lubricating jelly on the tip. Okay, so I'm going to insert this red rubber catheter, and I'm going to insert it pretty far.
Wait, Bubba, hold on. That's good. A little further. Okay,
Okay, so she's going to kind of pinch the rectum, and now I'm going to get the air out of the tip of this. There we go. And just nice and steady. All right, and I'm just going to insert this just nice and steady, not too fast. Good boy, buddy. All right. Okay, and so we did this outside, so it's a little bit less mess to clean up inside. So what we're going to do is we're going to hold the rectum shut for a couple more minutes, and then we're going to walk around outside with him to see if he can eliminate some of that enema. And that is how you perform an enema on a dog. So today I'm going to demonstrate how to apply a topical medication. So what I am using today is called deoxychlorhexidine pads. These are for little yeast infections on the skin, or maybe bacterial or fungal. My dog here, Emma, she does have a little bit of a yeast infection between her toes. Now, normally if I were at the clinic, I would absolutely be wearing gloves. However, I am at home with my dog, so I'm not, but normally I would. So these pads in particular are a cleansing pad, so I don't need to pre-wash the feet. All you do is, this is applied twice a day for 7 to 14 days, and then to be reevaluated by the veterinarian. So all you do for this topical agent is it comes in a little pad, and you just take the area that you are treating. In this case, it is the foot. So I'm going in between her toes, and I'm just making sure that I'm wiping all the areas and getting all of the skin. And I will, once the pad gets a little bit dirty, I will flip it over. Once that other side gets dirty, I will use a new pad. And that is how you apply duoxochlorhexidine topical pads. If I were to be applying something like a topical flea prevention, what I would do is I would part the hair up between the shoulder blades, and I would make sure that I part the hair completely so I am releasing the liquid directly onto the skin. In cats, this is particularly important to do high up on the neck so they can't lick it. And that is another type of topical agent that you would use to apply to the skin. Alright, so today I'm going to demonstrate cleaning and medicating a dog's ears. This is my dog Tommy. I'm doing some of these procedures at home because I work in an emergency clinic and we don't perform these there. But I used to work at a general practice in which we did do these things. So I'm going to demonstrate on my dog cleaning and medicating ears. This is Tommy. So the first thing we're going to do is I have my helper holding him. So what I'm going to do is I have this cleaner here, and I'm going to put some drops into the ear. Now I will be careful not to touch the ear with the tip of my cleaner because I don't want to contaminate it. So I'm going to, and normally I would be wearing gloves. If I was at a clinic, I would be wearing gloves. So I'm going to take some of my cleaner, I'm going to squirt it down into the ear. Then I'm going to massage the ear, and you can hear a little bit of a squishing sound. So I'm just going to massage this for a few seconds. That's breaking up the dirt. And then I'm going to wipe it out with some cotton swabs. And it's helpful if they shake their head. Sometimes Tommy doesn't always do that. Okay, alright, so now I'm going to take my clean cotton ball. I'm going to wipe down in the ear. You can see getting a little bit of debris. Fortunately, his ears were not very dirty. There we go. Okay, just going to wipe a little bit more. If the ears were very dirty, I very well may use the cleaner again and massage and wipe out. However, his are really pretty clean. To apply a medication to the ears, this is Mometamax. This is an ear medication. So the procedure is to clean ears well, let them dry, and then place the medication. So normally we would clean the ears, give it a little time to dry out, and then place the medication. However, for this video, I'm going to demonstrate applying the medication. So similar to the ear cleaner, what I would do is just pull back the pinna of the ear. I would take my medication and I'm going to apply 4 to 8 drops. So I would stick it down close to the ear. Again, I would make sure not to touch the ear and contaminate the tip of the medication. So what I would do, pull back the pinna, do 4 to 8 drops, and then I would massage the ear again to make sure that the medication got down to the bottom and covered the entire canal. You would repeat this process on the other ear. And that is how you would clean and medicate a dog's ears. Okay, so today I'm going to show you how to clean and medicate a cat's ears. This is my cat Bugsy. If I were at the clinic, I would be using gloves to do this. However, we don't typically clean ears and apply ear medication at the emergency hospital that I work at. So I have my partner here holding the cat. I've got my cleaner, and what I'm going to do is I'm just going to pull back the pinna of his ear a little bit, and I'm going to apply the cleanser down into the ear canal, being careful not to touch the ear with the tip of my cleanser. So I've got my cleanser here. I'm going to pull back the pinna a little bit. I'm going to place a couple drops of my cleanser in, and then I'm going to massage the base of his ear to mix the cleanser all around his ear canal. I would do this for a couple seconds and then let him shake his head. Then I would take my clean cotton balls and I would wipe out the inside of his ear. Okay. Then when I was done, before I applied the medication, the ear medication, I would typically give it a little time to let his ears dry. However, for the purpose of the video, what I would do is I've got my ear medication here. It would be applying it very similarly to the ear cleaner. I would pull back the pinna. I'm going to place 4 to 8 drops into the ear canal. I would make sure not to touch the tip of the medication to the ear canal. And then just like the cleaner, I would sit here and massage the ear to make sure the medication was distributed well throughout the ear. I would perform the exact same thing on the opposite ear, and that is how you clean and medicate a cat's ears. Okay, so today we're going to do sub-Q fluids into this guy Ben here. We're going to do 800 milliliters of lactated ringers. So I've got my bag of lactated ringers here in this slam bag, and this is a bag where we can pump it up so it delivers the fluids quickly. I've got my IV line here. It is primed with the fluid. This is a new 18 gauge needle. We use the 18 gauge because it's bigger, we can get the fluids in quicker. So what I'm going to do is I'm going to pull up his skin here between the shoulder blades, kind of tent it up, and then I'm going to take my needle in parallel with the spine, making sure not to go down because I don't want to poke him in the muscle and the spine, anywhere like that. So Veronica's holding him. I'm going to pinch up the skin, and I'm just going to go right in. Okay, and now I'm going to release the bag, and we're going to give 800 milliliters, and we will do it over a couple different areas just to make it a little more comfortable for him. Okay, so I will, when we're all done, I'll finish videotaping. Okay, so we're done delivering the 800 milliliters. I'm going to pull the needle out. I'm going to hold down on the spot for just a minute with this gauze pad to kind of help it clot up and keep it from leaking out. And then I will explain to the owners that this will absorb into the body over the next 12 to 18 hours. And that it will gradually shift down to his chest area and to expect that and not to be alarmed by it. And that is how you administer sub-Q fluids.
Yeah, what she said.
Okay, so today we're going to trim this puppy's toenails. Lauren is going to hold his leg out for me. And so what we're gonna do, these are small toenail clippers. If you wanna come a little bit closer, so you can see pretty easily where the nail kind of curves out at the end. So if you just clip that edge that's hanging over like that, then you pretty much are guaranteed you're not going to quick the animal. So I'm just gonna clip these little edges just like that. Good boy. Okay. Let me get his little nail here. Okay, so if I were to quick him, we could use something called Quick Stop, or you can use cornstarch. And what you would do is you would get a little on your finger or have it in a little bowl and then just hold it in there until it clotted. But he was actually a really great patient, so I'm gonna go ahead and do the rest of his nails. And that is how you trim a dog's toenails. Okay, today I'm going to demonstrate how to trim a cat's nails. So what I have here is I have a small animal nail trimmer. I had just demonstrated at work how to trim nails on a puppy, and this was the size trimmer I used. However, for my cat's nails, what I use is just a human fingernail clipper, since their nails are so tiny and so thin. So the first thing I'm going to do is have my holder hold him and restrain him while I trim his nails. Okay, so to trim a cat's nails, what you're going to do is you have your clippers in one hand. You're going to lightly squeeze the digit of the cat's foot, or one digit, and expose the nail. So you can see there's a little bit of a pink area here on the nail. That is the quick. So what you want to trim is just that little piece of nail that is arching out. So, and what you're gonna do is just trim a little bit off. If you do happen to quick the nail, you can use something like Clotazol. This will help stop the bleeding. You can also use cornstarch if that happens. So I'm just gonna finish clipping this foot here. So again, just avoid right outside the pink mark here. You're just gonna trim off the very tip of the nail, making sure not to quick him. I'm gonna get the little, okay. And that is how you trim a cat's nails. Okay, so I'm going to take some dental x-rays. This is our unit, and I've got the sensor here parallel to the mandibular molars. You can kind of see it peeking out there. So I'm using a parallel method. Alright, so I'm going to press the button, and once it beeps, let go.
Beautiful.
Alright. Okay, for this we're going to do the premolars. We're using a bisecting angle technique. So I've got my sensor pulled up so it's almost basically where the tongue is in the mouth. And we're going to come underneath here a little bit.
Don't freak out if that pops off.
Okay, everybody behind the X-ray unit. Boom! Awesome.
Great.
Okay, thank you.
Oh.
Okay, so for this video I'm going to demonstrate hand scaling. So I've got my curette here, and I'm going to start up at the top of the tooth and pull down to try to get some of this plaque. So I'm going to clean this cat's teeth. What I have here is the scaler. This is the dental machine. This has the polisher, the drill, and the air water syringe. So what I'm going to do is clean these teeth. You want to go at kind of a side angle, not straight on, because you could damage the tooth, and no longer than 10 seconds per tooth because you could damage the tooth. Alrighty here. Oh, I made him bleed.
Yes. Yes.
Okay, this is the polisher. So I'm gonna get the polisher into this cup here. So you wanna fill it up, and then you're gonna brush it on the teeth. You're gonna go even up under the gum line a little bit. And this polishes away the scrapings you make with the scaler. Okay, now I'm gonna rinse it.
And we're not doing any seals on this table.
Okay.